Hey friends, today I'm going to talk about masks. I know it seems like it should be something that's been settled long ago with the COVID pandemic, but apparently there's still a lot of discussion and false information going around about the effectiveness of masks. So I wanted to make a quick video just talking about masks. Whenever you saw a lot of information about masks during the COVID pandemic, it was either somebody saying that masks work or masks didn't work. And the reason that's confusing is because if you are talking about a mask that's made in somebody's home, it's real hard to know how effective that mask is because it hasn't been tested. But when you talk about medical masks are very effective at doing what they're supposed to do. Unfortunately, not all masks are created equal because there's different roles for different kinds of medical masks. For example, this type of mask that's very thin, kind of easy to wear, just hooks on your ears, paper thin. This is not designed to protect the wearer. It is purely designed for like when the operating room staff is doing a surgery, they wear this so that when they cough or they talk, nothing comes out of their mouth and infects the patient on the operating room table. So we use these in the ERs if we're doing central lines, things like that, but not designed to protect the wearer of the mask. Okay, very important. It won't be very effective at doing that. So the other masks these are a couple different brands of N95 masks. I brought these home from a shift at the ER the other day. They're just two different brands, but the main difference between an N95 mask and that little surgical mask is that these are actually, they come in different sizes to fit your face because they have to fit tight against your face. And when they fit tight against your face and you take a breath in, you are definitely pulling air through the filter of the mask. These masks protect the mask wearer and are very effective, no matter what you hear in the media, very effective at protecting the person wearing the mask. So when we were taking care of COVID patients, these became very, very helpful for us. And we still use them now. Unfortunately, we were stupid before COVID, and we didn't even think hardly to use them in the emergency room. So we'd go in to see flu patients and everything without a mask, and we would just get the flu. Now that masks are a lot more acceptable, socially acceptable, we do, pretty much all of us will wear a mask like this whenever we go in to see a patient that has high fever, cough, congestion, that kind of thing. So this is just two different brands of N95 mask, very effective. So I looked at some of the issues that came up during COVID and where people would say masks can't work because of a couple of different reasons. And a couple of arguments were they cultured the masks and they found out that there was tons of bacteria and viruses in the mask themselves. How could this be something that helps to protect somebody if the mask itself is so infected? Well, it's a simple answer. The mask is a filter. So obviously, if it's working, it's going to have bacteria and viruses trapped in the filter, just like your air conditioning filter. So that's not an argument against masks. The other thing is that people talk about the space between the fibers of any of these masks is much larger than the size of a viral particle. And that's absolutely true. We're not trying to stop individual viral particles. We don't have to. Little tiny individual viral particles that might become aerosolized don't cause infection. They're not enough to overwhelm the local immune system. So we're not worried about single viral particles. We're worried about the droplets that carry thousands, if not millions, of viral particles. Those are the infection type droplets. And these masks are extremely effective at stopping those. So they're very effective at preventing infection, just like they're designed for. So just remember, two kinds of medical masks. The surgical mask is designed to protect the patient that they're working on from the person wearing the mask. This kind of mask doesn't protect the mask wearer. You can breathe all around these masks, so it's not a filter. These N95 masks, on the other hand, are filters, and they are designed to protect the mask wearer. As far as masks made by local church groups and everybody to try to have a nice, stylish mask, anyone's guess how effective those are. They have never been tested. So I hope that helps to kind of clear up some of the some of the issues or the questions regarding face masks and if they actually work. Again, I'm Dr. Joe Kraft, and this is the take-home message. I hope you enjoyed. Till next time, goodbye.